Hi, I'm Mauro Fradeani, and I would like to talk to you about the temporaries, specifically about the indirect technique, a special one that is called MIT technique. What are the characteristics? Once you know that the acrylic has some shrinkage, you should find a way through the MIT technique to the larger cervical fur to have an easy insertion, an easy intraoral position, and an easy and fast relining procedure. So what we need to know is that the acrylic shell is in some way not easy to really overcome the problem of fitting and the precision inherent in the traditional indirect technique. To obtain a shell that in encountering no hindrances to its insertion could be guided into the correct position directly by the occlusion itself. An ideal acrylic resin shell insertion is of course fundamental in order to reline in the correct position, equally valid whether the provisional restoration is fabricated before or after the prepared teeth, or the teeth are prepared. So normally what you see in normal cases, the technician will do the wax up until the margin between the gingiva and the tooth. That is a quite traditional way to do the wax up. But once you fabricate then the provisional, the shell that you obtain is most of the time it will be shorter and under-contoured because the contraction of the acrylic resin that is shown in many cases and visible in many cases. So now let me explain to you that when you have a case that is a large case, an extensive case like this, the problem of acrylic contraction is much more visible. It's not like one central incisor, but is in one entire arch. If one entire arch is involved, you can easily see sometimes problem like that. It means that the provisional shell doesn't go completely in, and sometimes become completely inclined. The occlusal plane becomes slanted, and not of course what we really love to have it. So you can also appreciate that the tooth preparation on the posterior area sometimes seems to be outside the margin of the provisionals. And in order to really have the chance to insert a provisional, the clinician is forced to re-prepare sometimes the teeth, to open even more the shell, creating some holes, and sometimes to breaking the provisional completely. And that is something that is really possible to see in many cases. So most of the time you vanify what you have obtained in the wax up, that is properly reproducing your treatment plan. Actually, it's not possible to replicate that on the provisional shell before relining. It does create a very difficult situation for the clinician that at this point cannot really create very nice provisional that cannot be copied to the final restoration, in the final restoration, because it is completely maybe inclined on one side or completely broken. So what is the limitation of the traditional indirect technique? There are the difficulty and sometimes the impossible insertion of the shell. So you normally use the finger in order to press all the relining material close to the margin to have an acceptable marginal fit, but still you will have the under control profile and the possible separation of the relining material during the refinement procedure. Most of the time this creates a kind of line between the original shell and the relining material, and that is not really easy to overcome this problem. So what we have started to use many years ago, exactly 27 years ago, we tried to understand if there will be any possibility to overcome this problem. And what we started to do it was to really sign an overextended margin, longer and even larger, because the first part of the cervical area is a little bit convex. So at this point the line that you sign here is achieved by the WhatsApp. In this case, we have the cervical third of this restoration that is longer but even larger for the reason I said before. It means that the first part of the cervical area is convex, so automatically will be not just longer but also larger. At this point, we use an instrument to sign this extended margin. When you achieve and when you receive from your dental technician the acrylic will be cut back until this extended margin. So once then you put your restoration inside the mouth, theoretically you should have your margins inside the shell. And that allows you to have all the excess that can be completely removed. On the contrary that we had before, that we have seen that we push with the finger to really catch the margin to close the gap. In this case, we have the chance to remove completely the excess of the resin, of the acrylic, of the relining material. So at this point also, the refining procedure will be much easier and much faster, because of course you work on subtraction and not on addition. So just to remember and to summarize what we said about the MIT technique, you have to draw with a pencil an overextension approximately 0.51 millimeter of the stone cast, and then overextended the wax up to the pencil line. Once you receive from the dental technician the shell will be still overextended, less than before, because of course you have some shrinkage and some maybe during the refining some shortening of this shell, and maybe you have an overextension about 0.2 0.4. At this point you insert the acrylic shell and remove the resin excess during the relining procedure, and then refine and polish. So what are the main advantages of the MIT technique? First of all, the easy provisional insertion and the easy intraoral positioning. That's the most important step. So in this way, you can really replicate what we have obtained in the WhatsApp. Then, minimal occlusal adjustment, because you are guided by the occlusion. Easy excess removal, because you don't push your finger against the margin, but you remove all the excess. And then, remember, this cervical enlargement of the shell, this enlarged cervical third, works and acts similarly to the customized tray during the impression procedure. So that's the reason why you can say that you have an ideal penetration of the relining material into the sulcus, an excellent marginal identification, and of course, working on subtraction, you have an easy and fast refining procedure. That is an example before relining on the left side and after relining on the right side. All the margins are of course comprehended inside the shell, and once you reline, all the excess you remove it, and it's very easy to arrive at this level and to achieve this kind of result. A short movie to show that in this old case we have removed all the restoration, and once you put your provisional, you go in front of the patient and you can see that you can be guided by the occlusion like that, but if you still want to change the axis, you have the possibility to do it, because it's absolutely large cervically. But of course, most of the time it's easy to do that because you have the perfect position and you relied in this particular way, just following the occlusion of the patient.